All right. Well, thank you for having me. A happy Friday, everybody. My name is Lukaz Mazur. I'm on a joint appointment between the School of Medicine with the Radiation Oncology Department, where I'm a associate professor and also a director of the Division of Healthcare Engineering, and the joint appointment with SILS, which I'm very, very grateful for. Um, just want to mention that it has been a tremendous opportunity for me to interact with many folks in sales and chip and really learn from the research that that is being spearheaded. And I do have to mention that the one thing about sales and sales people, that they all wear this really comfortable shoes. And here, unfortunately, in School of Medicine, we wear those uncomfortable shoes and ties and all these things. So that was definitely always a highlight for me to see. But thank you for having me at SILS. It has been a tremendous, great experience with students and teaching and getting to know you. I'm Polish. That's where I was born. I came to US around 98 on athletic scholarship, and believe it, I did not speak English coming to college. Um, but I really fell in love with this whole idea about academics and studying, and I really enjoyed that. So somehow it led me to do my PhD in industrial engineering, and I did it in healthcare. And I guess one of those why that this happened is my best friend, my roommate. His mom was vice president in Banner Health Systems in Phoenix, Arizona, and as you can imagine, my first few internships, kind of growing up, was to go in healthcare. So I fell in love, and I felt that was kind of what I want to do in life. Um, did my um, did my dissertation on applying Toyota production system, or what's known as lean concepts, to healthcare. That was kind of my first first research area. Where I really tried to understand, how healthcare processes are being built. And there was a really good research at the time spearheaded by Spear and Bowen from Harvard School, with kind of rules in use, and they discovered some really basic principles of how Toyota works and why are they so lean. And I applied these rules to healthcare on medication delivery system, and we produced series of articles from that. At the same time, we were really interested in terms of looking at human behavior. When they do, when actually people work under the systems where there are defects versus there's no defects, and what they do and how they do it. And we were trying to discover what are the forces that kind of play from the organization perspective, from the process perspective, and cognitive perspective, really, to move people in a direction of, instead of just fixing a problem, how do you become this enhancer? How do you get engaged in a continuous quality improvement? So we published series of public papers on that topic, and so that was kind of my first exposure to research. Is right there. How did I got from Montana State University to North Carolina? Because I was in this beautiful city called Bozeman, where I used to ski 50 plus days. It was a great life out there. But one day, actually, I kind of the CEO of Industrial Extension Service at the time from NC State visited us. And after a visit, when I was still a PhD student, they offered me a job to come to North Carolina and work for that extension service as a consultant and develop lean principles, for healthcare. So I spent about 2 years kind of driving around North Carolina, visiting small hospitals, rural hospitals, big hospitals, and providing services, which was a great learning experience for me, being able to be exposed to healthcare. And one day I did a project at UNC for Dr. Marks, and right after that project, he offered me a faculty position, which I took. I thought that would be a great opportunity. We had a little kid at the house, and that would reduce the travel for me and being kind of outside the house. So we took that, and I'm really happy I did, because things really worked out well for me here. I was able to get tenured in School of Medicine, and as I mentioned, and I'm able to interact with great folks from SILS, which is always a highlight for me. With this, being at UNC, I did set up a lab. We called it Human Factors Laboratory. And we really started to think, how can we apply other principles of industrial engineering, human factors, into into healthcare. So in this lab, the research we've been conducting for the last almost 6 years was, really to look at, why do we have so many human errors during the interactions with electronic medical records. So that was kind of our, what we were exploring. And at the same time, we were also looking at simulation-based training where we could enhance what we called safety mindfulness of folks. What can I do during training, and can the training be effective so that, if you can make some errors during the training, could that be a profound type of a moment for you with some debriefing that, you will remember these things. So when you go to the real practice, that experience in a simulated lab could last. And you could kind of think about, slowing down, not rushing, and really understanding that how easy it is to make a human error during these type of interactions. So we spent, a number of years doing research in this arena, published a series of papers, and actually this year, we've published 6 papers already on this topic, and because we are kind of finalizing a lot of the dissemination on this work. So it has been a really great experience there. Recently, what's happening, kind of our future, where we're moving forward, I'm really passionate about patient safety, and had a great opportunity in the hospital to build and expand our lab. So we've been asked as a division to provide services to entire medical center. So we receive funding on a yearly basis, which is a really nice kind of an arrangement when our lab and our folks here receive a really nice funding from the healthcare system, where we can engage students and PhD students and master level and really help at the higher scale. So right now, I'm switching a little bit my focus of research to high reliability organizations, because our system has decided that that's where they're heading. We actually today submitting a grant, which Gary helped connect me with a lot of folks from School of Business, and we kind of got together, worked for the last 3 months, and we came up with a very strong application for kind of how to build high reliability, how to study this, and we've raised a number of really interesting research questions, moving forward. So that's where we are right now. I hope that kind of moving forward, my goals is to get more students involved in our research, have students involved in our laboratory. We have plenty of opportunities to do usability studies, to do more on the simulation-based training. But as I mentioned, I think the next few years will be really dedicated to this idea about the high reliability. So that's me, and I appreciate the opportunity to give this short talk today.